Dr. Garfield was a true visionary. In 1965, he publishes an article in the Scientific American, page 1 of Scientific American, at a time when the most powerful computers had less computing power than the watch that I wear today, and it's just a simple Timex watch. He said, the computer will become the center of healthcare in the future. What a visionary concept, but today it is a reality. But we are the organization that has the comprehensive electronic medical record for outpatient and inpatient. And we are the organization that allows patients to send a secure email, schedule a visit, get a medication refill. We're the organization that provides a video to patients who may be in nursing homes or patients who are having strokes in the emergency department. We're the organization that creates flash drives for $5 patient can take. The technology leader of the world we inherited. We inherited that proclivity, that commitment from Dr. Garfield many, many years in the past. I said at the beginning that you're entering an era of healthcare reform. And tomorrow I'll be meeting with various groups of you who've signed up, and I'll be focusing on many of the changes that will be coming. But healthcare reform will simply change the way that we practice. And it's a 2,000-page piece of legislation, but there are 5 key parts. 5 key parts of the healthcare reform bill. First, it will cover 34 million more Americans. It's a wonderful thing. We have pushed for that for decades, and finally, the uninsured will become insured and can get the health care they deserve. It includes a second provision, which is what's called guaranteed issue. Even if you have pre-existing disease, pre-existing illness, you can still get the coverage that you need. And to make sure people actually get the insurance before they get sick, is the requirement of the individual mandate that people purchase that insurance. The fourth provision is that the bill is designed to be cost neutral and to cover 10% more people. So there's a reduction in Medicare payments, and there's a tax placed on commercial insurance companies like ours. And then finally, there are provisions to create accountable care organizations, bringing doctors in the community together, primary care and specialty care in hospitals, working together to provide care, try to become much like Kaiser Permanente. And it creates exchanges, the Expedia or the Kayak of healthcare, where people can go online and see a long list of healthcare alternatives and easily switch from one to another. And healthcare reform will create challenges. It's going to lower the dollars that we get paid per patient. Starting next year, we already know that Medicare is going to reduce its payment to us by over 5%. It's about $350 million of less revenue in 2014 to 2013. And it creates this added competition, creating new competitors and a new competitive marketplace. And so the question we have to ask ourselves, and as new shareholders you've got to ask yourself, is how do we want to respond? How do we want to respond to these new pressures? And how do we create a threat to an opportunity? We know how our competitors are going to respond. They're simply going to cut back. We've already seen Sutter and the Palo Alto Clinic reduce salaries by 5%. We've watched the academic medical centers freeze salaries, and we've watched other permanent medical groups cut their benefits. But I don't think that's the right solution. I don't believe that that's the right thing to do, either for the physicians or for the patients. I believe that what we need to do is to come together and work as one, to be able to figure out ways to continually improve the excellence of the care that we provide. And tomorrow I want to be with you. I'll be asking you to do things that are going to lead to greater quality and better service in more efficient and effective ways, ways that we can leverage our integration, work together through group excellence to provide better care to our patients, and in the process, overcome the challenges that we face. As some of you know, I have the privilege to teach at the Stanford Graduate School of Business, and one of the faculty there, Jim Collins, wrote a book called Good to Great. It chronicles those companies that in difficult times are able to succeed. And I believe that's the path that we have to go. For as good as we are today, we can become better. And becoming great is what we need to do. And greatness means that we treat every patient every time the way we want for our family and friends. Simply the right thing to do. And greatness means that we treat our colleagues the way that we would want to be treated. Even when it may be a little difficult. And even when it may be a little inconvenient. It means that we help each other to figure out the ways that we can provide the better care. And we count on each other to do it in every medical center, in every department, every time. That is what great organizations are able to do. This is our time. This is our opportunity to lead the nation. And the country is looking to us to set the standard, to figure out how to provide care in this time of major healthcare challenge and change. And so in celebration or recognition of this weekend, there are 5 things I'd like to ask you to do. 5 things to do as part of being a new shareholder. The first thing I'd like to ask you to do is think about something, some way you can improve the life of one of the colleagues that you have in your department. Some way you can increase their fulfillment and make their job just a little bit easier. And when you get back to the office next week, when you get back to the hospital next week, do it. The second thing is figure out some way that you can help with your colleagues, another department in your medical center, to be able to do their job just a little bit easier, to do their job with just a little bit more fulfillment. And when you get back to your medical center as a new shareholder, help lead that process. The third thing I'd like to ask is that every night when you brush your teeth, look in the mirror and ask yourself, did you do the best that you could? Did you treat your patients the way you'd want for your family and friends? Did you treat your colleagues the way that you would want for yourself? And if the answer is no, vow and commit doing better the next day. The fourth thing is encourage your children to become doctors. There are 500 of the best physicians sitting out there now in the child care camp. And we're going to need every one of them in TPMG in the years to come. And finally, I'd like to ask, 20 years from now, when one of you is standing where I'm standing right now, please remember to tell the history of our medical group to the next generation of shareholders. Please speak well, kindly, of the current generation. And please make sure they do the things that are necessary so the generation that comes after them has the same privileges that all of us have in TPMG today. It's my great pleasure to welcome you to Shareholder Weekend. I want to recognize all that you have done and recognize all that you will do. And on behalf of our 3.5 million members, I'd like to say to each of you, thank you very much and good night.